तो मिलेगा ही, इससे बिजली भी पैदा। पानी तो मिलेगा ही, इससे बिजली भी पैदा। पानी तो मिलेगा ही, इससे बिजली भी पैदा। पानी तो मिलेगा ही, इससे बिजली भी पैदा पानी तो मिलेगा ही, इससे बिजली भी पैदा
Hi, good morning, all. I request all of our esteemed guests and delegates and speakers to take your seat. Our chief guest is here. We'll start the inaugural session next 2 minutes' time. Thank you. Please take your seat. Yes. All of you at the 8th edition of APAC HealthTech Innovation Conclave. Tagline of this conclave is Enabling Healthcare with Technology. This event is presented by Schneider Electric, and for the inaugural session, we have eminent speakers from government and industry. And throughout the day, we'll have various sessions with the stakeholders from the hospital ecosystem and industry as well. So, without taking much time, I would like to invite chief guest of this conclave, Sri Naveen Suranatis and IS, Principal Secretary to Health and Family Welfare Department, Government of Maharashtra, to come on stage. A huge round of applause for him, please. I would also like to invite Mr. Bhupesh Arora, Business Head, Digital Energy Division, Schneider Electric, to come on stage, please. Huge round of applause for him. So before we start the inaugural session, uh, we want to welcome our eminent guest for the inaugural session. So for that, I will request Gopi Krishna Arora, co-founder of APAC News Network, to come on stage and officially welcome our esteemed guests for the inaugural session. Can we have the bouquet on stage, please? We welcome Sri Naveen Sonatis and chief guest of APAC HealthTech Innovation Conclave, the 8th edition of this prestigious conclave. We also welcome Bhupesh Arora from Schneider Electric. Before I give a small introduction about why this event has been organized, just a small intro about network. Our company's full name is APAC Digital Innovation News Network. We're a community knowledge consulting media company focusing on creating awareness on the importance of technology and sustainable innovation for various sectors as healthcare, governance, education, manufacturing, BFSI sectors. And we have been covering length and breadth of this country with this kind of meaningful knowledge sharing platforms where we bring communities together from government, industry, experts, academia, all can come together and brainstorm. And not the event, even is just the beginning. We also come up with the event report we share with our stakeholders so that some actions can be taken on ground based on the discussion on this conclave. So that is all about APC, Digital Innovation News Network, in short form, APAC News Network. And this is a series. When I say series, because this is the eighth edition. Last month we were in Chennai, and we thank Schneider Electric also for supporting us in this initiative. Uh, we know we have just come out of pandemic. 2 years have passed, and also climate change is a huge thing. Resilience and also climate action. Climate change is a huge thing. Resilience and sustainable healthcare infrastructure. And in that, technology is going to play a pivotal role to build that comprehensive healthcare infrastructure, which will ensure healthcare delivery to the last mile perspective, also for the hospital perspective. How can we make that ecosystem where we talk about sustainable and innovative, um, secure, resilient hospital ecosystem as well? So I would request Bhupesh to say a few words before I hand over the session to chief guest. Maybe Bhupesh can shed some light, or he can invite his colleague for a presentation. Over to you, Bhupesh. Thank you so much.
Thank you, Shovik. Again, I think healthcare is an important area. We all know. I think COVID has taught us a lot, and we all were going through a very different phase few years back. But again, I think it opened up a lot of avenues for us to move forward and look forward in a different way towards this sector. And we saw a huge support coming from all across the sectors, including industry bodies and even from the government also, primarily to accelerate that need. That need was always known, but again, the acceleration in a different form was really important. And I think that is where the infrastructure evolution blended with technology also came in forward. Again, we saw how contactless environment was created at that point of time in every single possible way when we were stuck with unprecedented situation of COVID few years back. So again, today the basic healthcare in any case was always the need, but I think how do we bring a better and improved things to the people of the community was really very important, and that is where again we saw a lot of evolution which continued to happen. And at our end from Schneider Electric, I think we also came forward to support and be partnering the same with the industry, primarily to help drive those initiatives which were there. So there were a lot of things which were debated, the medical infrastructure, primarily hospitals or even the medical colleges, they started to expand on a rampant pace beyond what it was happening. And then how we were evolving our infrastructure also became in a different way. So we always wanted an infrastructure to be always available, wherein the patient safety and patient care is at the utmost important visit there. So we came forward again to support that piece of evolution, primarily on that. Again, I again thank the entire industry body to be supporting that in, along with the technology players like us in this field, which is there.
Bhupesh talked about a very important aspect, that blending technology with infrastructure evolution and how Schneider is helping stakeholders to reach that goal. So let me invite Mr. Nikhil Kumar, Head Healthcare Segment, Greater India Operations, Schneider Electric, to give an industry presentation, and then that can also give an idea to Naveen Sona sir that what Schneider is actually doing in the healthcare sector. So may I request Mr. Nikhil Kumar, Head Healthcare Segment, Greater India Operations, Schneider Electric, to give an introduction to our audience.
Thank you, Shovik. It's indeed a pleasure, and good morning, all distinguished guests. I am Nikhil Kumar. I'll reintroduce myself. I'm heading the healthcare segment for Schneider Electric, Greater India Operations. So it's always a pleasure because I see we come across on such events and exchange our thoughts, and then we try to implement also. So it's a great pleasure to again closure with you all and see what next we can do in the healthcare domain. Yeah. So just to just give a glimpse on the futuristic approach on the healthcare, which will be people centricity and hyper efficiency and resiliency to the core. So these goals will be we will achieve those goals only when we make it fast track. In few slides, we will try to cover those things. So energy consumption will grow in on 2x factor, and in the field, and these we will discuss today that how in the context of hospitals and healthcare we can improve upon that, and across those events every day can affect patient uh, care giver as well, patients as such, and we need to plan accordingly for the futuristic hospitals. So confident that most of us, not all, but most of us will agree to the mega trends which are shown here, which are creating the unpredictable environment all across us. So be it the aging population, or we have broken supply chains, which were really troublesome for last 2 years, so-called, when the pandemic approached us. Then we have the energy pricing, which is shooting up and down. Then we have the outbreaks in the system, which were causing a lot of trouble in the overall healthcare system. So what is the next level of the development, or how we can prepare ourselves for this? So these are a few more examples or trends which we are experiencing, like the workforce in itself is a problem area. Then we have some patient expectations which have gone up during the pandemic times. So these are the few trends which are shaping the healthcare, and we need to be prepared. So it's a kind of tsunami which we need to see in the healthcare segment to improve upon. So what lies in the future healthcare? We need to shape according to those trends, so that digitalized all the healthcare system and put it on an integrated interoperable platform, so that we have the data to have and to make insightful informations regarding the healthcare system. So go digital hospitals. So these are few data points which are really on the higher side. If we don't collect those data, then we cannot take the actionables to prevent all the crisis situations. So as we speak, a new thinking is required for this, and each one in the August gathering should be involved for these changes. Digital technologies unify a lot of integration which are working in silos in the hospitals. So we partner with healthcare organizations to design and build a robust digital solution platform, which will be flexible for tomorrow as well. So the resiliency factor should be there. So we have smart load management, building automation, connected room technologies, and electrical distribution to give those insightful actionables. So now talking about a very unique and very important aspect which we can do in the healthcare is the eco-structure for healthcare, which Schneider is giving. So it's a 3-layer architecture which we built in a hospital, and right from the medium voltage till the switches, we have all the solutions which are connected, and that data can be connected on the edge platform, which is a software platform, unique in all the sense. So we have displayed here on the screen as well. So I will request that you just spare few minutes with our technical colleagues and just see that how we are managing things on the software platform for all the connected layer. Then we have apps and analytics. This is a very unique thing where we are doing a consultancy as well. And we are giving the actionables, insightful, proper diagnosis about the total electrical system which is there in the building of a hospital. So this is all the platform which we manufacture and build for the end user to see. So now going a little bit on the intrinsic front, that what these edge layers or the softwares which are connected to the devices can provide. So we have an integrated building management system. So it gives all the insightful data is collected from the connected layer of devices. So as we were just discussing in few forums that we have so many platform or the softwares which are working inside the hospital building. So this is an integrated and interoperable platform where we don't have a multiple silos, which prevents all the crisis situations, and it works for the critical aspects of that hospital. Then we also manage the total energy consumptions efficiently with our power monitoring expert software. So that's monitoring the total critical facilities of any building. So fire is one very important thing which we need to discuss and discuss deeply, because it's a main critical thing which happens in the hospital. So most of the facilities are due to the electrical failures which occurs due to fire, and we cannot do that in any hospital because it's a hypersensitive zone. So we have different sensors which we can put in the panels itself on the electrical side, and which gives the insightful data, and we can prevent all these mishaps happening. Then we have a very specialized panel, which is isolation panel. So it goes inside the OT. It puts the safety standards to the next level, and it prevents the patient and the medical staff from getting any shocks. And we can give insulation monitoring as well. So we know that where the insulation failure is happening throughout the circuit, and we can prevent that. We can more deeply can discuss one-on-one basis. And as the front, so we have very specialized panels on the power quality as well. The voices which are taken from the maintenance people who are working rigorously 24/7 inside the building of a hospital. So these are the few questions which comes into that mind of an electrical engineer who is working there. So we have a total energy management solution which is working dedicatedly throughout the building, and we know each and every warning signal which is coming from the building. So it's a very important line that you cannot manage what you cannot see. So we need to have the data which is coming, and then we can do the actionables accordingly. So certified power monitoring, some software is required for that. Now, just few more slides to end. So these are the footprints which we have created all across India, and these are all powered by Schneider. So these are chain of hospitals which are working. So this last slide of mine gives you a glimpse of all these global hospitals. These are the real pictures. So I'm hopeful that you will identify that there is a Indian hospital as well in this picture. So we are not far from things to be futuristic on the hospitals. So thank you very much for your patience.
Thank you so much, Nikhil, for highlighting that how Schneider is making an impact uh, by moving towards a connected system by leveraging technology and emerging technologies as well. You said that it's a small community in the beginning of your speech, but the impact is big. So, thank you so much. So, with this, I would like to invite Sri Naveen Sunanathasan, IAS Principal Secretary to Health and Family Welfare Department, Government of Maharashtra, to deliver special address as the chief guest. Uh, just to tell something about Naveen Sunanathasan, he is a policymaker, but he has got huge interest on technology. I think he's enthusiast on emerging technologies like blockchain, IoT, and he has written numerous numbers of papers and articles in magazines in India and world over. So let's hear from him from the government policy perspective that how he thinks that industry and government can collaborate more in terms of transforming public healthcare infrastructure. Over to you, sir. Huge round of applause for him, please.
Good morning. So, this event, Shavik, head of Schneider, all participants, different hospitals, and dear friends, it's indeed a pleasure to be here in this event. And first of all, I'd like to congratulate APAC for doing this very timely event. So I do believe technology is a very powerful tools to solve a lot of problems, and just a brief about our commitment as government of Maharashtra to be part of this journey of bringing technology. You'll be surprised. We are already doing AI based analysis of x-rays. So we are trying to bring in a lot of cutting edge technologies into government. um, Blockchain. Apart from that, a lot of analytics is actually going to happen. Some government of Maharashtra, just a brief outline, is it's a huge department. We run more than 250 hospitals, and we have close to 2 lakh paramedical staff, 25,000 doctors. It's almost a $2 billion annual budget. So it's a huge responsibility on policymakers like me to actually work on this. Now, coming to the kind of presentation we saw, I think IoT is one of the key factors. Apart from blockchains, IoT, there is of course so much talk about AI and machine learning, and there is also from a clinical side, uh, genetic, be it gene therapy or genomics, personalized medicine. These are all trends which are going to really take over the world. And of course, one of the things, in the context of what we just heard, I think I have a great interest in IoT. And uh, one of the persons I met, I mean, it's not far away from here. I mean, somebody is working in Maharashtra, has created a smart bed, right? It's a connected bed where the patient's vitals, their maybe their thermal signature, their movement, uh, the bed actually communicates a lot about the patient itself, and it's there. We are trying to demo that for the government also. That's whatever we thought in future is actually happening right now, and it's all available. Again, we have to capture, because they're all senior people in the industry. Innovation, I'll give you a great example of an innovation. Innovation could be many types. There's common knowledge, something very incremental, very radical thing like, maybe a Uber or a technology, or bringing two very disparate things together. So this is a interesting thing you'd like to know. We were having a meeting on mobility, right? So we are doing some work with IIT Bombay and looking at mobility assistance for people. And it so happens, my kid, who's a big fan of Marvel movies, like all kids of this age, showing me some motion capture, how the films are made. It kind of struck me like, okay, you've got motion capture where they put markers, and there's a camera which captures the joints and the markers and the movement of the person. In fact, they put a lot of markers on even the face, so facial capture, if you've seen films like Avatar and so on. So the people's expressions are captured. So I thought that's a great idea to look at people's mobility. So I just Googled it, and lo and behold, Singapore has already done that. Okay. So they have taken motion capture and they have put it on people who need mobility support, accident victims, people with Parkinson's, spine problems, and so on. This, I think, is really, we need not hunt for new technologies. The technology is everywhere. It takes that click, that eureka moment to see the connect, and you will probably achieve jump in doing that. And similarly, and in the common meme world, all these words are so common to us. AI, ML, but there's a lot inside. There's a lot inside. On it's beyond that. I mean, it's not going to run on your TCP/IP protocol, which our computers run on. There's something called a constraint application protocol, and so on. So these are very, very small. There are billions of them. So one of the key things, I think, apart from the building management part we heard, is the wearables itself. Right, patients of the future are going to be sent home with a lot of wearables, and it may be a ring, it may be a watch, it may be spectacles, right? So which will give continuous stream of data about the patient. In fact, we are talking to a lot of international players in different governments. So we are working on a MOU with government of Sweden, Singapore, Australia, and so on. So one of the technology providers had a video analytics solution. What is that? To capture all the patients who are in the IPD and just do video analytics on them. Are they too still? Right? Are they too still? Are they not moving? So maybe that's a problem. Are they moving too much? Could be a problem. How's their sleep? So if you put a video analytics team on this room, they'll be able to tell each of our pulse rate, because the AI models can see lot more information from the vision. So they see the microscopic movement of our body, and they deduce the pulse rate by just looking at you. Yeah, they can do that now. So the sky is the limit. And iris scan. I am told, I was in a panel with Google team, head of Google Health. So Google Health is doing some crazy things. They have run iris scans through AI models and they mapped it to diseases. Now, iris scan can predict uh, diseases beyond imagination. You look at your iris scan and they can tell you what all diseases you have or you're likely to have. So there is no limit to technology. And hospital management, coming to the last part of uh, technology and hospital management, I think connected devices is it's a great thing, and we are not really even scratch the surface of this. Imagine the simplest thing is like your pharmacy places orders for you, right? Your stock room doesn't alert you to replenish the stock, but your stock room orders for you. That is like, if you look up the one of the biggest trends of the year, it is IoT based payments. They call the Internet of Payments. So you enable your uh, you know maybe your ICU can order the drugs for you. It's like that. So there's no limit to kind of thing. And from a policy perspective, now the challenges are immense. We have the digital mission. A lot of us know about that. But data security and consent of people's personal information is a very key factor. And different standards are there. So we are trying to merge all the different standards of health data into something meaningful, and making systems talk to each other is a big challenge in government. So data integration is a big challenge. And this divide of artificial divide of public and private healthcare has to go. The patient's journey, we have understood, is not restricted to just one segment. Referrals can be to private, it could be to specialized hospitals within government, or it could be a central government hospital. So interoperability is going to be a huge thing in healthcare. So Ayushman Bharat is actually building that fabric. And again, to people from the major hospitals, as a person running the digital health mission of Maharashtra, so we would definitely encourage adoption into the ABDM platform, and ask for the ABA number of all your patients. When you do a patient registration, simplest thing is to ask for a ABA number. Otherwise, generate it in your own hospital. This would pave the future for bringing all the patients together. And of course, we are also doing a huge thing on fire safety. Patient safety is a huge thing for WHO, including wrong medicine, wrong diagnosis, adverse events, physical infrastructural events. So the idea is healthcare should not be a reactive uh, industry. It should be more preventive, and by keeping people more healthy, overall the economic dividends are huge. I think we're all in this for the ultimate welfare of the patient. In fact, the vision of the honorable Prime Minister of this year's is the ease of living, ease of healthcare. So is it affordable? Is it accessible? Uh, is it seamless? How can we reduce the out of pocket expenditure of people from a policy perspective? So the challenges are many. Technology, I think, is going to really make a difference. And again, in concluding, lot from industry and from each other. So I'm glad to be part of this and thank Shawik ji for having me over. So without taking more time, so I congratulate the organizers and to Schneider to be part of this event, and quite exciting to see a lot of things happening there. So wish all of you the very best for the this event, and have a great day. Thank you so much.
Thank you so much, Sri Naveen Sudanartisan. I remember in one of our healthcare event in Mumbai last year, sir was a speaker. He talked about a very simple thing because he talked about innovation. He said, why can't we try to do a simple thing in hospitals? Can we give a tab to all our nursing medical staff instead of writing on paper every time? Can we have a tab? Can we ensure the tab given to all the nurses in all the hospitals so that everything is connected? And there's a small innovation, but that can help in a huge way. And you also talked about the patient safety, fire safety, and how IoT is playing a major role. You talked about Ayushman Bharat Digital Mission, ABA card. We have a speaker. We had a speaker from Ayushman Bharat NHN, National Health Authority. He was saying that this Ayushman Bharat Digital Mission is actually will be the UPI moment of for healthcare. And he was saying that uh, now they're working on a particular thing that there are medical records. It's lying with the hospitals, it's lying with the patients. But when they're sending, it's coming as a PDF. But how can we make those records in a streamlined process so that that is readable by machine? So they're working on that. That's again an innovation, and they're asking for industry partnership in that aspect as well. Because you talked about ABD for Maharashtra, so I just thought to touch base upon that. Thank you so much. With this, can you have a huge round of applause for chief guest address for this exciting speech and insightful analysis of how Maharashtra healthcare is working. Almost $2 billion budget, 250 plus hospitals. And I was just told by Navin Suna sir that they don't hype it much, but Maharashtra's healthcare department is actually the biggest department of the state government, if I'm not wrong. Thank you so much. With this, I would like to invite Sri Gopi Krishna Arora to come on stage and kindly hand over a small token of appreciation from our end to Mr. Naveen Sunartisan, the chief guest of this conference. A huge round of applause for you, please. That was the inaugural session of the 8th edition of APAC HealthTech Innovation Conclave. With this, I request eminent speakers for the second part of this conference, that is a panel discussion on building resilient and sustainable healthcare infrastructure with Health 4.0 technologies. And for that, I would like to invite eminent speakers from the hospital chain. Let me invite Dr. Srivatsan Sridhar, Group Director and COO of Sir H. N. Reliance Foundation Hospital and Research Center. Can we have a huge round of applause for him, please? May I invite Santosh Marathe, Regional CEO, Western Region, Apollo Hospitals, to come on stage, please. A huge round of applause for him as well. May I invite Dr. Parag Rindani, CEO, Wokhart Hospitals, to come on stage, please. Let me also invite Joy Chakraborty, COO, PD Hinduja Hospital and MRC. Let me also take this opportunity to invite Sankarishwan Jayaraj, Head Infrastructure Projects, Tata Trust, to come on stage, please. And also, I'll request again Bhupesh Arora from Stein Electric to join us for this panel discussion as well. So, without taking much time, let me first shoot the question to Dr. Srivatsan Sridhar. How do you think that the digitization is helping healthcare stakeholders in making buildings safer and where patient experience. You heard about how patient safety is important, as chief guest has said, and also Schneider speaker has said. So your thoughts on that? How do you think safer and also enhancing patient experience? Your thoughts on that?
At the outset, would like to thank the organizers and uh, the esteemed guests who have all come here. So, so it's all about how we design. So the quality by design concepts have been actually fairly established, and what we have found is when the automated BMS, that the building management solutions and all have been put in place, we always see there is an enough of traction which is always seen in the overall efficiency of the hospital. And this entails not only in the lead certification, which is on the eco-friendly initiative. So it's always fairly deciphered that we build hospitals which are all like running for decades. So we have seen a lot of hospitals who have been there, which have been there for multiple decades. As a sustainability, we have to see the technology. We are combating the technological obsolescence and trying to build the hospitals of the future. So that's the first essence we would like to imbibe. Secondly, our speaker before the Snidler, they had spoken about the video analytics and also about the concepts in their space. So I think those all are very important when we embrace technologies at the start of it. We have also seen that whenever hospitals are building technologies, they always, as administrators, try to see where they can cut costs. So that's always been in the backdrop of their thought process. However, we try and see how we can see when we solve this jigsaw puzzle of getting the technology embraced, the efficiency being put in place. Have been the concepts which we are trying to work on.
I really like the last part when you talked about that we have to embrace technology. There's no other option, but also we have to think about cost cutting, or how much cost effective it is. But I think it's a need of the hour. We have to invest in technology. There's no other way. No running away from that. Let me take a perspective from Mr. Santosh Marathe from Apollo Hospitals. So if you can just highlight some of the digital measures being adopted for patient care in your hospital chain. Maybe you can touch base upon the how your hospital is leveraging emerging technologies like maybe blockchain or robotics or video analytics, AR, VR. Your thoughts on that, sir?
Firstly, thank you for the invite. I think interesting topic, and I think most of the solutions in healthcare are getting IT enabled. And COVID was a big change element, as we all understand. The manner in how healthcare is getting provided and availed, both have undergone a radical change in terms of this thing. Three important points: how Apollo has done some meaningful ways of adopting technology. One is definitely a lot of things have happened in patient accessibility. Lot of virtual solutions, lot of access solutions are available to the patient on a remote basis now. So as contactless solutions, as we talked during the COVID time, I think these solutions are here to stay. We are seeing a lot of integrated solution, whether it is e-ICUs that we talk about, e-ecos that we talk about, e-ECGs that we talk about, centers which are hosted by the hospital within the vicinity. So that accessibility has been a huge plus. Handheld apps like 24/7, what Apollo has been a change. Anybody who can have an access across the board. And one of the larger advantage for a group like Apollo with 77 hospitals, it gives access to all our senior clinicians across the spectrum. So anybody sitting in Chennai can have an access to the most experienced consultant sitting out of Delhi. So this has in healthcare is empowering the patients. I think the whole role model and healthcare delivery system is moving towards ambulatory care. Daycare is one of the concepts which is evolving very radically and strongly. And there is a lot of empowerment which is being given to the patient in terms of having access to their patient health record, having access to converged database. I think no longer you can work in isolations and islands. So once when this kind of public-private initiatives happen, with having access and thing, having one medical record and having a again meaningful way to point of view and ambulatory care. There are a lot of home devices. Obviously, with FDA approvals and everything, I think it's a little fragmented market out there still, but it's becoming a little bit more matured in terms of meaningful ways where the patient and their families can be empowered in a meaningful way to take care of their own prognosis in terms of what needs to be done. The third important thing as a concept within Apollo also what we are trying to do is a concept of behavioral clustering. So what this mean, and as I think Principal Secretary also touched upon that particular thing, is to create cohorts of individual disease profile. So in a meaningful way, that video also what example was given, I think in a meaningful way, if you could start defining clinical pathways for a diabetic population, then in a meaningful way, we can start capturing it in a much more appropriate manner. And the whole paradigm shift again is getting into the wellness management rather than the illness management part of it. So this is one important aspect where with that kind of data registry which is being created, in a meaningful way, you can create disease profile, look at clinical pathways where the interventions can be done early on. And one of the meaningful way how Apollo has done it quite smartly is all our HIS is integrated with what we call as is clinical decision support system. So we have alerts which are being given to the doctors, to the pharmacologists, to the individual people where drug to drug reactions or clinical pathway compliance, those kind of alerts are being given on a real time basis. So in most of the cases, unfortunately, you end up doing postmortem, but this kind of real-time information really gives a good helping and aiding tool to the clinicians, to the care providers to use technology in a much more meaningful way. So these are a few of the aspects which we do within Apollo.
Right, right. As you rightly said, we all accept that COVID has been the game changer and how drastically things have changed in the span of 2 years. You talked about integrated solutions, converged database, home devices, and all info and monitoring of those data. Quite important. Let me go to Dr. Parag Ridhani from the Oakland Hospitals. Maybe the same question, if I can ask you that, what are the uh, digital measures being adopted by hospitals vis-a-vis the emerging technologies or newest technologies? Your thoughts on that?
So primarily, most organizations adopt technology to fight either the problem which we are facing now, which is that no offense meant to the government here, but the issue is that costing is something that is badly breathing down our neck. Payers are being told that healthcare is an industry which is probably out to profiteer, and while many people may not agree with me, the fact remains that everybody needs to make a decent profit to be able to grow, to be able to invest further. It's nice to have more technology, but remember it costs, and therefore this cost has to be borne by somebody. Nonetheless, even before COVID, I can safely say that we have invested in technology because of another factor which puts pressure on the healthcare systems of today. Let's face the fact that every person in the room who doesn't have a nursing college to his or her credit obviously is facing problems with nursing attrition, with doctor attrition, and it's because we want to circumvent these problems that we put up this entire hospital information system so that we are able to minimize the potential for errors. Accreditation, IRDA is putting pressure on organizations to get accredited so that you're able to get a higher percentage of payout. Let's not beguile ourselves into thinking that we don't want to serve. And the more efficiently we can do that, the better. 2-3 examples, classic examples. I think we spoke about the integration and to sort of send home a dead body and we've seen enough examples, whether it's politically motivated fires, whether it is fault related fires within the system. The other important thing is we've seen is that all said and done, a human being cannot react as fast. 2014, we invested heavily into an ICU monitoring system wherein everything that is around the patient was integrated with what we call the clinical decision-making support system, which allowed the triggers to come automatically not depending on whether a nurse was able to see that trigger at that point in time or no. And I think one of the most important thing is that today, whether it's feedback, whether it's patient information, whether it's information to give back to the referring physician in the community, because we all understand that that's an important part of the continuum of care. Our doctor connect with the community physicians has only increased. We would like to see more and more of that happening. We would like to see more and more of hospitals getting into that. But let's also understand that the Indian healthcare doesn't reside in urban India. We still have to look at Bharat. And for that, I think we should be extremely grateful to Prime Minister's initiative on the ABDM. I think just this morning we received some posters from ABDM because we are meeting up with them. So corporate hospitals are getting into it. But I think the crux is that the government has done taken huge steps to ensure that data integration happens. 10 years ago, we were looking at projects in Gujarat government and Maharashtra government to engage with them for NABH. And you'd be surprised to know that infant mortality consultancy services software. Are made, but I think clinical safety is where we've always focused on, and that's what I would say we've focused on, putting in more digital initiatives.
Right. Thank you, Dr. Parag. You talked about a very important aspect that it's not only when we talk about healthcare, let's not talk only about the urban India, but also the rural India, which is a huge sector, and how technology can help in that. You also talked about uh, how government has taken huge steps in near past in terms of data integration. That has been also important. Let me take a different perspective from the Joy Chakraborty, COO, PD Hinduja Hospital in MRC. Uh, Mr. Joy, you've heard the inaugural speakers, and till now you've heard we're talking about resilient and sustainable healthcare infrastructure, hospital infrastructure. How do you think comprehensive, resilient, and sustainable hospital ecosystem, if I may say so? Your thoughts on that?
Thank you very much for the invitation, and great to see many known faces here in the audience. And I remember in the inaugural the first one was resilience, then patient-centric efficiency, and then the fourth one was, I remember, sustainability. So we spoke a lot about this sustainability and resilience, but let me talk about the other two elements which needs to be addressed, and that can be addressed only through technology, which is patient centricity. So Parag was talking about, all this comes with a cost. But let me tell you, some of this cost initially looks, be done later or even now. And some of those examples I want to give you when we are changing in our hospital, the electric fixtures like bulbs, and you're getting into LED to save electricity. We had a huge pressure on us on electricity bill, and everybody was wondering whether it is the right decision. We got a payback period, which was very encouraging, and ultimately we've seen the success of it. I think again Schneider has installed in our hospital BMS solution. When you're doing a new operation theater project, the BMS solution was coming at a bomb, and about is it going to really give us the return? Now coming back to your answer to your question, let me tell you what you have not spoken, that already our honorable Prime Minister has committed for something like net zero by 2070. So if I think we need to address many things. It is patient care and how it can improve the patient satisfaction, patient care, and our pre-hospital care, then you have the hospital care or called intra-hospital care, post into the community who are not information. Some of those Dr. Santosh Marathi has mentioned, but most of us, we try to address the pain or concern when a patient is in your hospital. And when the patient is in hospital, let me tell you, and I wish none of us we come across that kind of experience and stage. However, we are getting patients and we need to take care of them. So the first thing is the communication with them. So there are different communication method mode what can be improved by using technology. The second one is talking about that getting different condition, whether it is heart rate or so. In our own hospital we have installed it already, and we can capture, and the most important part, early sign for any risk related taken to ICU, or they need early development with the help of artificial is present here by using the voice technology through dictation conversion. Those are the need of the hour, and which addresses the component of efficiency in the initial presentation. If you talk about EMR, maintaining managing records, again Dr. He has mentioned from Apollo Hospital experience, where we can see the continuity of the care which can go on from one hospital to the other hospital for a patient without repeating the diagnostic test, and many things that can be addressed through technology. And one of my most area is the diagnosis itself. Today when you do whether MRI hospital setup where all these technologies are there, you need to get a patient to a qualified ophthalmologist to identify whether they have any eye related problem. But there are several and many applications through technology, whether it is artificial intelligence and all. You can get this diagnosis done even in the rural area where most of our population they live. And finally, coming to this patient engagement, if you are engaged, you are connected to your patient throughout their life cycle, I think you have done your part of it. A patient they like it, doctors they love it, and hospital they enjoy it. And in that can think technology can connect, can get benefited out of technology and its adaptation, its application, which is going to take our Indian healthcare delivery a long way.
Right, right. Thank you. Thank you. Talk about patient centricity, net zero, which is very important in terms of climate action and also diagnostics. And there's no running away from technology in terms of transforming healthcare. Thank you, uh, Joy Chakraborty. Now, different perspective from Sankarishan Jayaraj from Tata Trust. He's the head of infrastructure projects. Uh, Mr. Jayaraj, if I may ask you that we know that Tata Trust is working in terms of capacity building and enhancing infrastructure in the healthcare sector. Where do you see the gap? Because we have here policymakers are here, hospital digital transformation leaders are here, industry leaders are here. Where do you see the gaps are there, which should be addressed in terms of capacity building or improving infrastructure, hospital infrastructure? Your thoughts on that?
Yeah, to start with the customary thanks to the Schneider Electric and the APAC for organizing this. And here, let me take a clue from what Mr. Natesan has said. First of all, Tata Trust being a philanthropic organization, And our focus in the last 5 years or 6 years has been into affordable cancer care. We have been engaged with various governments, even in Maharashtra. We are coming up with a cancer care hospital in Chandrapur in joint collaboration with Government of Maharashtra. So our mandate has been to take cancer care closer to the patients. Affordable, sustainable, technologically advanced care solutions closer to the patients, most likely into the tier 2 and tier 3 cities. That is where all the challenges come. How do you make cancer care available to someone who's in the remote corner of Northeast? How would you make it sustainable? How do you make it future proof as well? So you need to in terms of data and software, energy management, all those things. So that is where actually we are, the space planning and design and into, the overall the fund available with the government, or what the money that we can pump in from Tata Trust. It's purely philanthropic, of course. So you start with the design, and then how do you adopt all the technologically advanced features like building management systems, energy integration, and also, to a large extent, with CCTV these days, you can also monitor motions, fire safety, automatic extinguishing systems. So these are all, a lot of technology which is also being built in, and also the space planning, and also the overall cost of construction. And finally, to make it sustainable, what are all the energy conservation measures that you are going to build in while designing, and whether you're looking at solar rooftop, or your, net zero, in terms of looking at not only the carbon emissions, and also, recycling your water, and ensuring that you're not letting out any wastewater into the um, ecosystem, and you're able to optimize on the water and electricity and other costs, and also making it fire safe. That is also a very important aspect of it. It is the design, adopting technology, making it sustainable. That has been the challenges that we've been facing while putting up these hospitals in the remotest corners of the country. And COVID also has taught us a lot of lessons. And when we were mandated with setting up COVID hospitals, that time we didn't have any clue of what is COVID. The technology comes when there is a disruption, or the technology itself can be a disruptive technology. So adapting to the technology, to the worst of the scenario, we were given a mandate to set up COVID hospitals in collaboration with government of India. And successfully we completed 7 COVID hospitals across the country during the worst conditions possible. And that is when all this technology, remote monitoring, remote control, managing your supply chain, everything, helped us a lot. And also, of course, we have also worked with Schneider Electric in a lot of our cancer hospitals, directly or indirectly. That is what I would sum it up. Right. Affordability, sustainability, and technologically advanced, futuristic hospitals. These are all the keywords which throw challenges to people like me who build infrastructure.
Right, right. And I think connectivity is also a major thing which we should also address, because when you talk about taking the healthcare delivery to the last mile, especially in the unreachable places. Connectivity is a major problem still today. I know 5G, 6G is onslaught is there, but I think still a long mile to go before we have that comprehensive model. But as you rightly said, these are the challenges. But again, technology can be a game changer, as you rightly mentioned. You talked about the COVID situation. We all have seen how telemedicine, which was like no one was quite eager to use telemedicine, how it became a game changer during the COVID time, not only in urban India, but rural and semi-rural areas as well. Thank you so much. I'll come back. Bhupesh, you heard about the you also in your initial speech by Nikhil in the inaugural also, he talked about the connected system, moving towards a connected system. What, according to you, are the benefits of a connected infrastructure, especially for a hospital or their everyday functioning? Your thoughts on that?
So, from my point of view, again, I heard all the panelists again. Technology can help a lot beyond the efficiency what we see. So today, I think we see a patient coming into a hospital primarily for a procedure or for an emergency care. But there are many activities around the patient which needs to be taken care in just enough time, and the availability of that infrastructure is really important. I think technology can help first improve the efficiency of those infrastructure availability to patient, while the fastest possible attention and care by the various stakeholders. Patient may be in a OT for a procedure, but there are a lot of things which happens pre-surgery or pre-procedure and post-surgery. So if this interconnectivity is designed in a way wherein the stakeholders who are supposed to act on a glimpse of a minute, they can do that. So in the room, when the patient is admitted, moving to the procedure room and then coming back to the room, there are plenty of stakeholders like nursing station, there are housekeeping activities, or the areas, they need to be alerted the movement of the patient. So if that can be done automatically, the availability of the infrastructure for patient will be faster. The alertness of those stakeholders can be much faster. And then the respective stakeholders, be doctors, they'll only focus on their procedure, rest of the things will not. So we are not moving the papers, and the alerts are on the screens directly as the patient is moving from one room to another room inside the facility which is there. This helps us to first turn around those areas. Today, the hospitals, many hospitals are running out of the availability of these critical places to address more patients. Apart from patients' reactiveness, this technology can make the infrastructure available to serve more patients also in the same amount of time. I think that is where the technology is heading today. And BMS is not only a system primarily to take care of an HVAC, which was an original thought. All these interconnections of various infrastructure inside a facility can help the facilitation of all these movement for the patients in fastest possible time. Secondly, availability of the rooms like X-ray rooms, CT rooms are also really critical. So it's really important for the availability of those rooms so that the patient's movement is also aligned from that perspective. So you need to know today I may have 20 patients waiting for a procedure or a facility to be used, but how do we plan that is really very, very important and efficient. So I think all these becoming together is going to help out, and that is where the technology is more number of patient services in the same amount of time and the same infrastructure which is going to be there.
Right, right. Monitoring real-time tracking. That's the advantage of connected infrastructure, as pointed out by Bhupesh. I know we're at the end of this session, but quickly, I'll give you 20 seconds to all of you. One say. 20 seconds to you. Where do you see the future of India's healthcare story going in terms of building resilient and sustainable ecosystem? 20 seconds to you.
So it's all about EMR adoption, the electronic medical record adoptions by players and getting connected healthcare. So that's going to be the need of an hour. And on the end-to-end digitization, because as players, we have seen as healthcare players, it's very imperative that we have seen a lot of case scenarios when the patient is actually picked up from the home, say smart ambulance with the 5G enabled technology, and getting the AI enabled tools in the radiology to have faster diagnosis and getting a kind of a care pathway being established well in advance. And we have seen a lot of patient outcomes being improved. So that is the thing which we have seen a lot of benefit to the healthcare sector. And you will see a lot of the telemedicine going into a rejig of version 2.0, 3.0 coming in place, where the urban rural integrations will also come in place. So this is something which I wanted to envisage and bring into place our concepts.
Right. Thank you. Mr. Santosh, your thoughts on that?
So I think IT adaptability has been evolving quite rapidly. And I think based on the Prime Minister's vision, the digital highway that we are talking about, pathway in terms of integrating most of the interoperability between multiple players, that's one important element. And second is insurance penetration with Prime Minister Healthcare Scheme. I think definitely accessibility to healthcare will be standardized in the coming days in terms of this. 2 to 3 quick changes, what we are seeing seamlessly happening to the overall thing is, I think a lot of people will get into collaborations, which is very much important, because rather than wasting resources and abusing resources over a period of time, I think collaborative approach is something which will be a good one. And one fresh breath of air, what you can say, up till now, the focus was always standardizing cost. But in the recent couple of years, I think standardization of the care pathways is also evolving in the Indian subcontinent. So that will be a meaningful reference point where a care provided by a healthcare provider can be meaningfully compared with another healthcare provider. So I think these are good developments, and IT definitely will standardize and reduce the variability in care. As we always keep on saying, in healthcare, IT is a big plus in reducing the variability in healthcare.
Mr. Joy, your thoughts quickly, 20 seconds.
So I think last decade we have seen, or till last decade we have seen, the technology and all were getting too much into medical care, medical part of it. But now it is coming 360-degree. The way my previous panelists have told, whether it is IT, whether it is even infrastructure, whether it is even non-clinical areas, in all aspects, it is going to get integrated more and more, and which will not make the healthcare affordable alone. It is also going to make it accessible. I think the healthcare entire ecosystem is going to go in a long way. I think I'm in 28 seconds.
Thank you so much. Dr. Parag, your thoughts.
I wouldn't be so optimistic and utopian as my fellow panelists. I do see challenges. We've just launched the NABH has just launched the digital health standards, which is just about a month ago. I do see, given the vagaries that we've got, doctors from CMC Vellore performing surgeries differently than, let's say, those who come from PGI Chandigarh. I think the vagaries will continue to remain. However, it's a fantastic move. Digital health standards, commonality of purpose. I think the moment similar outcomes, I think that's when the whip will really get cracking.
Right. Quickly, Mr. Shankarashwan Jairaj.
Has always been our this thing, taking affordable healthcare closer to the patients. I think the virtual reality and artificial intelligence and connectivity can play a great role. And as a fraternity of investors and the medical planners, so it is our duty to take healthcare closer to the patients rather than making patients travel to the tier 1 cities and then spending a lot of money in traveling and staying. Puts a lot of stress not only on the patients but also on the family members. The entire technology has to be used how to take healthcare closer to the patients.
Right. It reminds me of, I think Naveen Sona sir will also agree to that. Policymakers tend to say that we should not see citizens coming to government offices. That should the banking sector. How many of us go to bank? Because the services are there in the doorstep. As I rightly said, if we can improve the connectivity, maybe 50% of patients should not go to hospital. This can be addressed in their home with technology, devices, and everything. Let's hope for that day can also come. I can see Sir smiling, and also Dr. Parag is smiling. But let's hope for the best. So I'll end this session with a take from Bhupesh from Schneider. Bhupesh, 20 seconds.
So from my perspective, the country's infrastructure will continue to expand, but we see technology helping to increase the efficiency of the existing infrastructure by at least 30-40% in terms of more patients to be served with the same infrastructure as well.
Right, right. Thank you so much. Can you have a huge round of applause for this wonderful panel discussion on building resilient and sustainable healthcare infrastructure with Health 4.0 technologies. We have only 1 minute with us. If you have any question, we can take 1 or 2 questions. I think we have a question. Can we have the mic there, please?
Is this technology is reducing the cost of hospital care? My question to panel.
Who wants to answer this?
Um, so definitely, overall cost per patient, we may not be able to answer, sir. But I think overall scheme of things, cost of healthcare in the country will come down because of reduction of errors, because of speedier thing. But as far as individual cost, we have seen those patients where we prevented errors, definitely cost has come down.
Actually, I wanted to give the same answer, but if you have any particular technology on which you have question, I can give that case.
Screening of the patients, because there is overcrowding. In hospitals like corporate hospitals, there is a different use of technology. So I want to know whether this type of technologies, that is cost, care, and computers, whether it is creating more complications or
Okay,
more
I'll answer
efficiency,
you. I'll
or
answer you
reducing
quickly.
increasing efficiency, reducing the cost of the care.
See, I'll answer you quickly. When you say cost, do you consider the benefit what you get out of this cost? When I'm talking about 1988 in Hinduja Hospital, we started using vacutainer for blood collection. So definitely it is a matter of cost for the patient. If you see that, okay, earlier you are doing at X, now it is X plus. But by using this and by spending more money, what is the benefit you have got? Now, if that benefit supersedes the cost, and in this case, yes, so it become much safer and better use. Definitely, it is a better in terms of application. Now, I'll take something very recent. Again, I'm very fascinated to talk about that technology. What Mr. Swana was talking about, that getting the patient vitals and predicting. Now, if you can capture that, then definitely it's benefit, which is a much bigger in terms of. So if you look at it in the holistic way, I'm sure no hospital, no one wants to have some sorts of elephant in the room, which is going to be a more expensive affair without thinking what benefit it is going to give.
So one more thing, I think on most elective surgeries, all hospitals in the city of Mumbai have probably shaved off at least a day of the stay, thereby reducing the costs, including packages costs have now come down across the city in terms of most elective surgeries. CABG's patients are now with minimal invasive are going home on day 4, day 3. Total knee replacement patients are going home on day 3. So I think mostly this does lead to saving of the patient's cost as well. I'm talking about direct money out of the patient's pocket or the insurance.
Okay, I think we can take these questions offline also because next panel is ready. Thank you so much, all of you. Let me thank Dr. Srivatsan Sridhar, Santosh Marathi, Dr. Parag Rindani, Joy Chakraborty, Shankar Shwan, Jayaraj, and Bhupi Chawda. Can we have a group photo with Naveen Sona, sir, please? Yes, I think Naveen sir stayed back to hear this panel, so we can have a group photo with all the speakers here today. Neha can also join us for the photo. So with this, we move to the next part of this panel discussion. So we divided in 2 parts. This panel discussion for this, let me invite Dr. Manisha Bobade, CEO KJ Somaya Hospital Research Center. A huge round of applause for her, please. Let me invite Sir Nilesh Shinde, Group CTO, Jupiter Hospital. Let me invite Binu Williams, Group CIO, Grange Medical Foundation, Ruby Hall Clinic from Pune. And also, let me invite Bhupesh Arora, Business Head, Digital Energy Division, Schneider Electric to come on stage. I have been told that Dr. Deepak Patkar, who's from Nanavati Max Super Specialty Hospitals, is stuck in the famous traffic of Mumbai. So he'll be joining us soon. So we welcome all of you for joining us today. Thank you so much for joining us today. Let me start with, okay, the theme of this session is also the same, building resilient and sustainable healthcare infrastructure with Health 4.0. But I hope the questions will be different so that we can have a different take from this set of speakers from the earlier panel. Let me start with Dr. Manisha. She has got huge experience in the healthcare sector. Because since she has got huge experience, I want to ask her about a futuristic question. How are the hospitals looking at next gen tech innovations to be at the vanguard of their sustainability campaigns? Your thoughts on that?
Thank you for inviting us, and thank you, Goswami, for getting this entire group of expertise under one roof, so that it is a big going to be a learning lesson for everyone, as well as to express the thought. Technology. We are just talking technology. I would like to express my thought about a technology. My basic qualification, I'm an emergency consultant and intensivist, then turn into the administrator. The technology advanced in such a way, in leaps and bounces, that it is really going to boom in near future across the globe, and so in India as well. I would like to talk about a technology not only in the hospitals, because most of the hospitals are advancing as per their capacities to the highest possible technology to deliver the best quality healthcare services. But India's population majority being in a huge gap in a patient and a doctor ratio. We need to leverage a lot on the technology if we want to close this gap. And it is very much possible. Government is already initiating a digital ecosystem, which they are developing by gathering the patient data, and which will help the healthcare authorities, providers to come together to develop the strategies, to anticipate a lot of illnesses, make the plans, how we can allocate the different resources to meet their demands as well, so that the better outcome can achieve. Most importantly, another thing is that this is just not possible only by the doctors, healthcare providers to take a lead. It is very important that public needs to come forward, and good networking between healthcare provider and community is very, very important. Communities already started getting involved by a lot of technologies, like wearing this lot of wearable devices, which has made it possible to capture a lot of their own parameters data, better accessibility to the healthcare services, early approach, early detection, patient care. That is very much possible because of these wearable devices. I would like to add on one is, apart from government, there is a huge opportunity for various healthcare providers and corporate group to come forward and to contribute to reach out to the rural areas. And I'm very proud to get associated with the Somaya group, where we have a center across India at 4 places, where these are the places in the rural areas which are stationed approximately 100 to 200 kilometers away from Mumbai. And these places scatter the healthcare services across different villages, which takes care of a number of students to get educated at free cost, as well as, most importantly, the healthcare services. We have stationed a lot of technologies which we have used to give the point of care test for all these villages, so that their screening is possible, early detections are possible, because super specialties are not possible to get stationed all the time. And the technologies we get communicated to the telecommunications, by which we can deliver the best healthcare services. So, digital healthcare, yes, a huge thing to contribute, and we can do wonders. India being very compassionate, we will do wonders equally.
Right, right. Thank you. Thank you. I'll come back to Dr. Manish. Part you have raised that, which some of the parts we already discussing in the earlier panel also, that how we can transform the healthcare delivery in the rural India or the tier 2, tier 3 cities by the help of technology, and how hospital or healthcare infrastructure can be made and efficient. Uh, and obviously, connectivity is a problem, but again, connectivity can be the game changer. We can see it as a challenge or as an opportunity to change the game. Thank you so much. I'll come back to you. Let's have a perspective from Mr. Uh, Nilesh Shinde, Group CTO, Jupiter Hospital. Uh, in earlier panel, Mr. Joy was talking about the net zero thing, the climate change. So energy efficiency is a very important part, Mr. Nilesh. So how can we implement energy efficient measures to achieve best energy performance index, especially when it comes to hospital? Thoughts on that?
So first of all, I would like to thank APAC for giving this opportunity for this event. Moving on, when we say about energy efficient or resilient or sustainable building, with my experience into projects, I believe it starts from the project itself. And when we are talking about connectivity, okay, so project I will divide into three parts, like design and implementation, and after that execution, and third thing is the operations. Okay, so when I'm saying design and planning, we need solution which has to be given by the company to the project side. Because what happens that when we say that architect is there, project management consultancy is there is always a gap. There is no connectivity between them. And what happens, whatever we design on paper, but when we do execution during the project, like in project, if you say that there is a one common word which normally used at least in Mumbai is like 19 bis. That 19 bis is something like that, whatever has been designed and what has been executed on site. Okay. And then it comes the operational phase. So operational phase is something like that. The person who is operating that, he is not part of that project itself. So he has to work on the whatever that's the drawing which has received to him. Now to everything has to be connected, it is better to work on the Revit drawings or building energy information system drawing, so that we can able to correlate between all the things from the design up to the operation phase. Now the new software which has come during the construction also, which can give you an idea what is a life cycle cost of the, not here I'm not talking medical equipment, here I'm talking about the equipments what are being used in the maintenance side. Okay, for the building whatever, we can get very clearly life cycle cost of that. Now energy modeling softwares are available. Before start of the project only we can able to make out how much energy we are going to save in that project every day. When the project starts, so when we say for the energy measures what we need to take in a hospital, if you see in hospital, if we divide everything, then HVAC 50% is on higher side, in a HVAC per day. Now we are talking about medical equipment. So medical equipment, what we are talking, CT, MR, Linac, cath lab, everything. The requirement is like 120 kV or 160 kV, huge requirement there. But if you see that whatever they are consuming, maybe not more than 10 to 11% of the entire bill of your electricity. Now, if you consider other than that, what is involved, like UPS, what we use other than medical equipment panel, and which can be used for the blood bank or maybe your emergency lighting, the refrigerators, whatever are there, OT, ICU, also contributes more than medical equipment panels. So if you see that, my experience that with my all three hospitals, like 14 to 15% is consumed by that. Now, elevators is only 2 or 3%, STP or ETP is around 4%, CSAT is around 3%, and raw power is around 7 to 8% when I'm talking about that. So what is important which is contributing is HVAC. So when we are planning something for the net zero carbon, so what is important that for the building point of view, building envelope, if you consider the roof insulation, then the brick walls, what we are going to as the exterior side, and the third one is that glazing. So roof insulation, you know that once you come across, you will come across our terminology like U value, thermal transmitter. So better the lesser the U value, better is the OPEC, or that is a good product what we need to use it for the hospital and to reduce the energy. Now, when we are saying U value or what is thermal transmittance, is like whatever the energy which pass, like even if you're having a single or composite material, the whatever the rate of heat transfer between these two material divided by the temperature difference. That is U value, and U value has to be as low as possible. So consider that roof insulation. Everyone is having maybe some roof insulation. There are two thoughts, like we should have overdeck insulation or underdeck insulation. So if you do overdeck insulation means what? Like normally what we do is that on top of your floor, rooftop floor, you use normally waterproofing material. If you add some 100 XPS insulation also, your U value will go down drastically. That is very, very important. Rather than doing underdeck insulation, overdeck insulation always will give a better solution. Similarly for glazing, if you are having a glazing, when we are saying that the window and wall ratio should be less than 40%, and when we are saying that glazing, there are two aspects for that. That there are, for energy saving purpose, there are glasses which are available where nothing will come inside. But whether doctor or patients will be happy with that scenario? So answer is no, because he's not looking for artificial lighting. He's looking for natural lighting. So you have to figure out between natural lighting, what is the best for the patient. And similarly, now one more important point is that along with that, when we see that medical equipment require humidity less than 60%. And now that is the challenge, how to achieve that in Bombay like city where it goes to 99% RH. We have to bring it down to 60. So earlier they used to use electric output of condenser, like the chiller which is there, the condenser output of that can also byproduct we can use to control humidity as a hot water. Or second thing is that, which is the best, which been used most of the time, it heat pump. So heat pump will give a very reduced energy, as well as you can able to control its humidity. Now important point, one more thing is that if you see medical equipment, and I work for a has to maintain between 20 plus minus 2 degree. I don't know from how these figures have come, because if you see that even if you change from 20 to 23 degree also temperature, there's a huge saving is there. Now I understand that during when a patient comfort point, they are looking for 20 plus minus 2, but if you see their original technical data sheet, you will see that all these are operating condition up to 26 degree. There will nothing will happen to the machine. Okay, and humidity has to be below 60, and that too also non-condensing. So when I'm saying that, during maybe any machine that may be in use 9 hours, definitely it will be on idle state. During that period, like even from 22, if you increase, or 20, you can increase to 24 degrees. This can happen in OT also, not in ICU, because ICU always the patients are there. So even if you do in OT also, there's a huge difference. You can just see when we are changing from 4 degree, there's a huge difference is there. Huge saving is going to happen. These are small innovation what we can do. Like these are small efforts. Maybe I'm not sure that is going to make a huge impact on the HVAC, but yes, it is making for us, at least we are making sure that every day I'm saving around 150 to 200 units. Now, we cannot just say that it will be 1,000 units or 4,000 units in a day. These small contributions are going to make a huge impact. Now, along with that, there is also called as free cooling. Environmental as a atmospheric pressure, temperature we are keeping at 24 degree. So can we use that? If the temperature outside area is around 18 or 17 degree, we can take that the free cooling and we can use that. So heat recovery, free cooling, these are the things we can always do it to make sure that net zero carbon. And I'm sure that with the new technology and with the end-to-end solution, because that is very, very important, you can able to track that if the things are going out of control. Because now with predictive breakdown analysis also, we can able to achieve good energy efficient hospital. Thank you.
Right. Interesting take. You talked about the gap, the design stage itself, and where there's a gap between design make a difference in terms of energy efficient measures for while building hospitals or upgrading aging hospital buildings to a new one. I'll come to Vidumam, but before that, I think it will be pertinent for me to ask Bhupesh, because Bhupesh is handling this kind of, I may say, challenges and opportunity as well. You just heard Mr. Dilesh, Bhupesh, that he talked about certain opportunities and also challenges in terms of energy efficient measures. So can you shed some light on how some of the tech advancements is making a mark in terms of when we talk about
technology, and I heard Nilesh a lot on HVAC. Again, HVAC plays a really important role, primarily to be managed well, and a lot depends upon how we design the infrastructure. Primarily, again, the flow of patients may vary during the day. The utilization of the infrastructure may be varying during the day. We may not be using all these infrastructure where extensive HVAC is being used all through the day, 24/7. So we need to have those areas or timings available known either through a mechanism wherein we are able to mechanize our systems that they operate at different times or different temperature zones at that point of time, which is there. So there are sensors which can help detect the number of patients in a room, which adjusts the temperature accordingly. Again, we need not to move manually to 20 to 24. Again, depending upon the count of the patients which are in the room and the ambient temperature which is required to serve them well is really important. Similarly, the facilities, whether it is equipments housed in a room or the patients using OTs or ICUs or different rooms, they can be mechanized completely on the availability. The sensors can detect the presence of because single rooms are very easy to do mechanized, because if you don't have a patient inside, the energy bill should go down, it should go switch off. When a patient is moving from a procedure, the lighting as well as the HVAC before the patient even moves from one floor to another floor, hence saving a lot of energy bill, which is really important. So I think these savings are not only primarily to bring down the energy cost and bills, but again, this money saved is reinvested back in the infrastructure on different things which is there. So there are plenty of ways wherein we can move and reduce these energy bills in an infrastructure like hospital.
Right, right. Let me ask a different question. We heard about the emerging technologies or the next gen technology. We heard about the energy efficiency measures. Let me take a different perspective from the Vilu Williams, who is the Group CIO of Grand Medical Foundation Ruby Hall Clinic from Pune. If I may ask you that, how do you, or you can, if you can give an example, how your organization is implementing or leveraging emerging technologies for enhancing patient care or safeguarding the hospital building, all the overall ecosystem, maybe emerging technology like blockchain, AI, analytics, VR. Your thoughts on that?
Good afternoon, everybody. So, and thank you for inviting me today. Before I go into the emerging technologies, I would like everybody's attention to be drawn to one major aspect of digitization in a hospital. That is the patient, what does a patient want? The patient wants service, which is extremely efficient. He wants care, which is again efficient. I mean, from his own treatment perspective. And he or she really doesn't bother whether you are using the latest MRI for his treatment or whether you are using the best HIS system and so on. So when we are talking about this emerging technologies, what we first see as CIOs or as IT from information technology perspective is that, do we have that efficiency built into the hospital that gives both the performance as well as the productivity which the patient needs? A very small example: how many of us has really managed to save the waiting time for a patient in the hospital? We are struggling at that level. Going ahead, how many doctors are really, we are driving a lot of adoption from an EMR perspective in the hospital, where we want to collect the data that will help us, really take benefit of the emerging technologies. Have we collected that amount of data digitally in the hospitals? I know all my colleagues, all my different hospital friends, everyone talks about digital and everyone has moved far ahead on the digital app, but nobody can really claim that we have reached this stage of digitization which has brought these outcomes. So if I go into blockchain, or if I go into AR, VR, or if I go into AI, I'm personally, in fact, data science and AI. But have I really not only to be seen from a digital perspective? When we talk about emerging technologies, let's consider the medical side of the technology and keep IT aside for some time. Yes, the best of diagnostics, the best of labs, the best of treatment areas for the patient, where emerging technologies have made a huge impact, is in the diagnostics and the this, where we are looking at uh, emerging technologies from a patient's benefit. There is a lot of things done today in hospitals, even in Ruby Hall, for example, in my own hospital, where there is the latest technology adopted at every stage, irrespective of how expensive, because we look at the benefit from the patient's perspective, as the previous panel also discussed. If we could reduce the length of stay for the patient, if we could reduce the treatment time, if we could if you could increase the accuracy and reduce the errors, then that technology adopted makes a lot of difference for the patient and benefits for the hospital. And in such cases, the hospital, I'm sure, is not shying away from investing in those technologies, which matter. It also then in turn gives you the benefits of sustainability, because it is helping the patient in at least on the medical side.
Right. I think important part what you have said is that it's not only about embracing technology, but to identify which technology is suitable for my scheme of things. There must be multiple technologies, but I have to identify which technology can be of help for me, and accordingly I can invest on that, which can give results. That is very important. We have come to the end. Let me start with Dr. Manisha, who is the CEO of KJ Somaya Hospital Research Center. Uh, uh, if I say that, if I may ask you that, uh, when we talk about the hospitals of future, right? What aspects do you think that India should follow to achieve those goals in like ABC? If I may ask you, smart hospitals of future. What are the focus area should be there for you as who's been in the healthcare sector for so many years? Quickly, ma'am.
Directly healthcare. Most important thing is securing the patient healthcare data. Right now, 60% of our Indian healthcare have become the victims of, and we need to secure the data for the patient's identity, for maintaining the confidentiality. Then its use of this healthcare data to be used by the healthcare authorities to make the future plans, which can be planned to make the better healthy India. That is one of the most important thing I feel, which has a huge scope for Indian healthcare to focus on.
Right, right. Thank you so much, sir. Mr. Nilesh Shinde, Group CTO, Jupiter Hospital. Quickly, sir, 20 seconds to you.
So our Prime Minister vision of net zero carbon in 2070. So everyone should think in that way, that energy management solution we need to give it. Like for our own hospital in Pune, we are doing almost 16% energy saving per day, and which has been awarded by Ministry of Power India for that whatever we are doing. And our very clear idea is that the new project which is coming in Dombivli, we are planning for 26% of energy saving per day. So thought process is very clear. Small contribution towards our Prime Minister aim towards net zero carbon. From our side, we are going to do it. And second thing is that when we sing patient centric or everything connectivity, so in that everything patient. And third thing, that slowly and steadily, whether we like or not, but then we need to move to cloud, because looks like that is the, because every time maintaining everything on our in-house server is going to be challenge. And I believe that future will be cloud for connectivity.
Cloud for connectivity. Nice tagline. Vilu Williams, Group CIO, Grand Medical Foundation, Ruby All Clinic. Your thoughts on that, ma'am? Quickly, 20 seconds.
Smart hospitals have always been my favorite topic, actually. And for me, creating a smart hospital starts with better connectivity. Whether it is the connectivity within the hospital, it is connectivity remotely across the country. The connectivity is the most important. Second is when we talk about digitizability, this is another area where we need to focus. As Nilesh also said, cloud is going to be the requirement. We cannot sustain on-premise for a very, very long time in terms of cost as well. And cloud will become cheaper and cheaper. So definitely a smart hospital will need to have that kind of interoperability and connectivity to which are bringing together the rural and the urban areas together, closer together, closing the gaps. And of course, digital space is moving towards that. Wherever the patient needs to be, the patient should get the service in that space itself. And hence, again, connectivity plays a very big role in that. So in future, if this is improved, there will be a lot of changes with respect to the making the hospital smarter.
Right. Thank you so much. Bhupesh Arora, Business Head, Digital Energy Division, Schneider Electric. Ma'am talked about smart hospitals. Let me ask you a different thing. 20 seconds to you. We know the smart hospitals or the new greenfield hospitals will be that. What about the aging infrastructure, the so-called unsmart hospitals? How do we make a difference on those kind of infrastructure? Your thoughts on that? 20 seconds.
So, aging infrastructure or existing infrastructure can also be digitized on a very nominal cost. So we need not to replace everything. We just need to bring connectivity to the non-connected systems and just bringing that data into it. And I'll just add to the smart hospital thing also, because cyber secure digitization will help ease of accessibility and availability to more people. So I think that is where it is going to be important. So whether it's an existing infrastructure or new build, we will have to move it to digitized world, which is really important.
Right. Thank you so much. Thank you so much. Huge round of applause for an exciting set of speakers for the panel discussion on building resilient and sustainable healthcare infrastructure with Health 4.0. Let me again thank Dr. Manisha Bobade, Nilesh Hende, Vilu Williams, and Mr. Bhupesh Arora. Thank you so much for joining us today. Let me also inform all of you that there will be an award felicitation ceremony right after the next two sessions around 1:45. So I request all the eminent speakers to stay back till that time. Can you have a group photo and then we can move to the next session? I can also request Neha Sharma from APAC News Network to come on stage for the group photo. Join us, please. Can you have the group photo, please? With this, we move to the other segment of APAC HealthTech Innovation Conclave, which is the 8th edition. This session will be on digital hospitals of the future, leveraging technologies to patient experience, staff management, transform care delivery, and operations management. For that, again, we have eminent leaders from the hospital ecosystem here with us from the city of Mumbai. Let me invite Dr. Kunal Punamia, CEO, SL Raheja, a Fortis associate. And I invite Dr. Kunal to come on stage, please. Singh, C. I invite Dr. Nilesh Singh, COO, MRR Children's Hospital, to come on stage, please. Huge round of applause for him. Dr. Clive Fernandez, Group Clinical Director and Group COO, Oakard Hospitals. Dr. Clive, you can also join us, please. Huge round of applause for him. Dr. Hardik Ajmeria, Medical Director, Saifi Hospital. Thank you so much for joining us today. And let me invite Shweta Sharma, Segment Head Building, Schneider Electric, to join us on stage, please. A huge round of applause for her as well. And can we have a chair on stage, please? Thanks, Shweta, for joining us today. So, without taking much time, I know we are running short of time, but we are running late. Let's come to the point. Let me ask Dr. Kunal Punamia, who is the CEO of SL Raheja Hospital, the fourth associate. Dr. Kunal, what, according to you, is the concept of digital hospital of the future? What does it mean to you?
When you talk about digital hospitals, basically, what is the role of digitization? It is basically to have lesser interaction levels with people and have more automated system. Somewhere down the line, when we look at technology in hospitals, we only keep on looking at high-end equipments and gadgets which are for doctors. But somewhere down the line, we start to need to invest in technology which is going to touch patients. How can you ensure that if a patient wants to seek an appointment, he can do it digitally, pay it digitally, just come and meet the doctor who he wants to meet. Accordingly, if a prescription is generated, like a bill is generated in any other place, if a prescription is generated which comes to him on, and he scans it and he can get the medicines, life becomes a lot simpler for him. And that is where he gets the wow element. uh, if a patient is admitted in the ward, uh, there's so many interactions that they happen with nurses and the housekeeping staff. But half of the time we are talking about call bells, and a person will come attend to the call bell and then probably go back and call the relevant person. Can he actually ask for the service directly, what he wants? If he wants a nurse to attend to him, can he ask for the nurse? If he wants someone to help him with a pot, can he ask for that relevant service? These type of digitizations, even the billing part, he can have a update. These things will not only improve his satisfaction levels, there would be more transparency in the transactions, and probably you will also invest less in your overall operations, making yourself more efficient in how you function.
So, if I can take a crux of what you said, less of interaction, more of automation, resulting in increase in efficiency.
Exactly.
Thank you so much. Let me take a perspective from Dr. Nilesh Singh from MRR Children Hospital. Uh, Also, the same question to your thoughts and vision on the digital hospital of the future and how it can transform healthcare.
So if we see digital hospital, I think digitalization is the future of everything. And when we talk about hospital, as Dr. Kunal, we have to see not only engaging, making EMR, but we also have to ensure that we make the clinician, empower the clinician to take a proper decision, in which we integrate all the EMRs, all the digital radiology diagnostics, which is available to the clinician just a click, which enables him to take a proper decision making for treatment. Second, digitization can be used to empower the patient in order to have an access clinical decision making. Everything is there. Taking small aspects, like as Dr. Kunal said, just we all have a problem of patient waiting in queues, and a waiting period time of patient at home itself, pay by a QR code. He just needs to come, at the hospital, scan his QR code and make him present and directly go into the queue, rather than standing in the entire line of, standing behind people and waiting for his turn to come. So that's what is digitization, what we should look at. Digitization is going to touch base every aspect of the hospital. It's not just going to be the patient care. It will be, like Dr. Kunal said, for the, basic services. Right now, since we in India are, healthcare professionals getting in healthcare, we all will agree that it's a challenge getting trained professional in healthcare. We all are struggling with it. So if we can look into that and we can digitize it entirely to reduce, and optimize our patient healthcare by making nursing enabling nursing, we connect all the devices so that entire data can be seen by the nurses digitally. Housekeeping, housekeeping can be efficient. Porter management system, a very simple thing which if it is digitized right now, we have all seen that we have reduced the cost of transport of medicine going up and down, using manpower for doing it. That's what I will look for digitization in every aspect of the hospital.
Digitization at every aspect of hospital. Again, no running away from that. But again, how to use that technology efficiently, that is the goal. Let me take a perspective from Dr. Clive Fernandez, Group Clinical Director and Group CEO, Wokhart Hospitals. Sir, maybe electronic health records or telemedicine platforms, whatever digital technologies we're talking about, how do you think that can improve the coordination or communication or continuity of care across the departments in a hospital chain? Your thoughts on that, sir?
First of all, good afternoon, everyone, and thank you, APAC, for this opportunity. We talked about digitization. How many of us heard the term IoT? I've been sitting in the room for the last 2 hours, and I just thought if we had an IoT which said, "Is it cold now?" How many of you are really feeling cold? A lot of us would have put up our hands. Coming back to your question, when you talk about digital, I would like to sum it up as, digital is about work smart, don't work hard. That is what it ultimately is. And if you heard most of our speakers now in the morning and people later also, we all agree. So it's about work smart, don't work hard. Cost and all are secondary. Now we talked about electronic medical records. So I will just focus on electronic medical records, although digitalization has so many different aspects. How many of us have actually seen a doctor's handwriting and say it is legible? Now we talked about continuity of care. So someone talked about errors, someone talked about cost. And at the end of the day, we have to look at an outcome, a safe outcome for the patient. So when you talk about an electronic medical record, just look at how many benefits happen by making it electronic, access. Which is a hard copy and it is in the basement. Subah se to every provider at the click of the button. That is very important. So many times updates happen later. So when you talk about digitization, medical records, how does it help? Easy accessibility to all stakeholders. In spontaneous update. And the best thing is, reduction of errors. Now, at the end of the day, Dr. Parag was talking, we were just talking, everyone is looking at the West and the West is looking at us. It's not about only digitization. Our goal at the end of the day is safe outcome and efficient outcome. So if you look at any of the digitalization techniques or whatever, Kunal, Nilesh, and anyone spoke, we are trying to make the systems efficient.
Right. End of the day, our sole aim is that making the system efficient, and to do that, we have to work smart and leverage technology, but at the same time, accessibility to the data, that is very important, and how to use that data. There is no dearth of data in today's age, but at the same time, how well we can use that data for our own benefit, that is also important.
And I wanted to just take 30 seconds to answer the second part of your question, telemedicine. Now, telemedicine did not come during COVID. It has been here for donkey's years. We all know that. It just actually people really realized the importance of it during COVID. But again, I'll play devil's advocate. Because of COVID and because of Zoom calls and telemedicine, today I'll tell you, the real customer actually wants to go to the OPD. He does not believe in the Zoom call. But telemedicine has actually taken healthcare to remote places where it would not go. And that is the importance when you look at people talk of hub and spoke, blah, blah, blah. It's all about connecting, small nursing homes who have ICU patients but don't have the expertise. You link them up via telemedicine and via the IoT of things where you're giving all the parameters to some big hospital where there is an intensivist who can just look at it and guide care. So that's how technology can help.
Right. Let me ask Dr. Hardik Ajmeriya from Saifi Hospital, your thoughts on how these technologies can help in the patient outcome, or enhancing patient's experience in hospitals.
Okay. Thank you. APAC for inviting me here, and thank you to my co-panelists and members of this august audience here for this thought-provoking session. Just giving a small context to the topic here. When I was, when I came to know of this topic, hospitals of the future, I became nostalgic thinking of an old science fiction movie, Back to the Future. Okay, where we had seen time travel, we had seen flying cars, we had seen robots doing surgery. As a child, I really happen in the real world. Today, 15 years down the line, yes, we have seen it all happen. We have seen flying cars being made. We are seeing, I am also seeing in my hospital robots doing surgery. Okay. And okay, time travel has still not happened. Sorry for that. Yeah. But again, there is a catch here. Although flying cars have been made, how many of us have actually sat in it? I actually have not. Hmm. Even though robots are doing surgeries, how many hospitals are able to afford it? So the catch here is, though the technology, what we have once dreamt of, is now ready, how do I implement it? How do I implement it for patient care, for patient benefit, in order to, of course, reduce the mistake errors, reduce the mistakes, improve the quality, improve the delivery, and so on. So the problem here is that yes, we are ready with the technology. We are very interestingly poised, the entire healthcare ecosystem. We are on the edge of a locked door to the future, which is digitized. However, to unlock that door, there are many challenges which we first need to navigate, which is the challenge here. So, going ahead, now if we are able to do it, which we have been able to do it partially. Partially, we have been able to achieve what? We have been able to achieve robotic surgeries. We have been able to achieve the voice to text software. We have been able to achieve another parameters like maybe rapid AI in stroke. All these things, again, at a cost, we've been able to achieve, and that has transformed the healthcare delivery. All the parameters, what you have mentioned here, patient safety, uh, operational management, staff management, patient experience, everything has improved because of that. However, the challenges of cost constraints, the sharing of data via interoperability, which means upgrading to HL7 and HIPAA compliance systems, um, data privacy issues, and most important, even if we can achieve all this, the resistance to change the way we are going ahead. All this has to be taken care of. Yeah. So we are somewhere, we have created the car, flying car, but now we need to sit in this car, number one. And secondly, now that we have created what we thought 15, 20 years ago, what do we want to create 15, 20 years down the line? That thought strategy also has to begin. Thank you.
Right, right. Important part. You talked about the affordable technology and whether we are ready to embrace technology in its new avatar, and also identify also trying to help to change the mindset of embracing that technology. Thank you, Dr. Hardik Ajmeria. We have with us Shweta Sharma from Schneider Electric. I think she's the segment head of buildings. So I'll ask her something about the buildings when it talks about hospital buildings, Shweta. Uh, if you can give some example or shed some light on how digitization is helping in making the hospital buildings safer. It can be a aging hospital building or a new hospital building, but your thoughts on that?
Okay, so first of all, very good afternoon to all of you, and thank you, APAC, for having me here. Now, to answer your question, Shobik, we heard, I think last 2 hours we have been talking so much about digitization, IoT, and digitization influencing different systems in the hospital or in a healthcare facility. So if you ask me, from a technology perspective or from a technology provider perspective, I would say digitization needs to happen at a system level. When I say system level, it means it needs to connect multiple subsystems and not only just one system. So digitization is helping us become more efficient. How? First of all, it brings us transparency. We have so much data. We have, IoT devices everywhere. In fact, the devices are being replaced with the IoT enabled devices. So much of data is coming into a system. And then what do? We see some dashboards, and then what? So the transparency is very important, and that's what makes us more efficient and resilient. It's time that we start talking about using these data to leverage our decision making capabilities, get more actionable insights from these, to understand the trend, or to understand what can go wrong, and get into a predictive and more on the condition based rather than just being reactive. So that's very important when we talk about digitization. How much are we leveraging it apart from just connecting devices to an interoperable platform? What else are we doing? So bringing transparency and hence becoming more efficient is what I think digitization has the capability to do.
Using data for decision making, a very important part you have raised, Shweta. And also, you talked about digitization can only be successful we see at the system level. When you talk about system, that it has to be done together. We should not see it in isolation or in a silo. Very important. I'll start with you because we have to wrap this session. Let me start with you quickly. 20 seconds to you, Shweta. If I may ask you your tech vision for building sustainable and resilient hospital ecosystem or health infrastructure, quickly to you.
So you have touched on my favorite topic, which is sustainability. 20 seconds. Okay, so sustainability is becoming more greener, that is one, but then it comes with becoming more efficient as well. So the moment you start using less energy, so digitization will also help you become efficient and hence make your facility more sustainable. Now, digitization need not be only in the operational stage. Digitization has to get into throughout the life cycle of any facility, starting from the planning to the build stage, to the design stage, then build, manage, and then operate stage. And that's when we see a true benefit of digitization.
Right. Let me take a perspective from Dr. Kunal Punamia. So your thoughts on the future of tech vision for the future when it comes to building sustainable and resilient healthcare infrastructure?
As I said earlier, it has to be patient centric. It has to be something that is going to impact the patient, and he feels that yes, this technology is working in my favor. It has to enhance his experience. It has to reduce his pain points, whether it is the waiting time, whether it is the accessibility to the service, whether it is you means a lot of us, whether we are corporates or whether we are government hospitals, we do see some level of bureaucracy everywhere. When I want a document, I want a record, everything is, there is a level of bureaucracy. I have to give an application and then I'll get it. We got to cut that. Things have to become simpler. So while we all enjoy and we relish the way there are apps like Zomato, Swiggy, Dine Out, Amazon, Flipkart, and you say, oh, shopping's become so simple, ordering food has become so simple. Can healthcare become that simplex with all its complexities of the science that it involves? That's important.
Right. Thank you so much. Thank you so much. Dr. Nilesh Singh, your thoughts quickly.
If you the digitization, according to me, it has to touch all the aspect of the hospital. It should be patient centric. It should also enable my clinicians to take a good informed decision for treatment of the patient. Third, it should be also optimizing the operational cost, reducing the errors in the hospital, bring down, because we all know, there are more deaths because of the operational, because of the errors happening. So reducing the errors, making the building efficient, making the operational efficiency, and reducing the overall staff management into a perspective where things can be management perspective more easier to control.
Dr. Clive Fernandez, your thoughts.
So everyone is talked about digitalization and sustaining. Take a different path. It takes two to tango. So what about the stakeholder buy-in? And I'll just give you an example. The CPOE came 15, 20 years ago. It was so that consultants write their own medications and reduced. Buy-in tha hi nahi kabhi. They gave their passport to the resident. Usko pata about we need to ensure staff buy-in. They need to know why this.
By the way, yeah.
Okay. I stand corrected.
Okay. So when we talk about building a resilient and smart hospital, I will divide it into four cornerstones. First would be obviously digitization, which involves EMR, telemedicine, and so on. Second would be AI, which is now coming up. Third would be automation, and fourth would be upgradation in health tech technologies like equipment, etc., and softwares. Now we discussed that there are challenges in implementing this at hospital level, at society level, at pan India level, everywhere. So we have under all these four parameters we have to inch gradually and try to achieve excellence and move forward inch by inch. It will take a long time, but it's on the right path. For example, if I talk about digitization, or we all spoke about ABHM, how many of us sitting here have a Aadhaar number generated for themselves? I at least have not. How many of anybody has generated Aadhaar number for themselves? No, nobody, right? So that's an eye opener. If we are not generating Aadhaar number for ourselves, we are expecting patients to come to us with Aadhaar number. So let's start somewhere ourselves. Let's inch forward one by one on all the four parameters and try to achieve what we just spoke about in the entire session. Try to achieve digitalization. Let's start at home. Let's generate a Aadhaar number for all of us today.
Right. Thank you. I think some of us do have Aadhaar number. I think Neha has. Yeah. So, but rightly pointed out, as Dr. Kunal has also said, his concluding remark that why can't the healthcare delivery be like the Flipkart or Amazons of the world? That's what ABDM is trying to do. They're saying that's a UPI moment of the healthcare delivery. But obviously, integration has to be there, and there are challenges, and those challenges have to be addressed. But technology is the answer. There's no shying away from that. But again, how to use that technology, how efficiently, which will result in increasing efficiency. That is important. Thank you so much. Can we have a huge round of applause for a wonderful session on digital hospitals of the future? Let me again thank Dr. Kunal Punamia, Dr. Nilesh Singh, Dr. Clive Fernandez, Dr. Hardik Ajmera, and Swetha Sharma from Schneider Electric. Thank you so much. Can we have a group photo? Now you can come on stage for the group photo and join us for that. And quickly we'll move to the last panel of the day. And again, I'm requesting all of our esteemed speakers to stay back because after this session, we have a felicitation ceremony. Thank you so much. Thank you so much. Thank you so much, all of you. With this, we move to the other topic, digital hospitals of the future, leveraging technologies for patient experience, staff management, transform care delivery, and operations management. And for that, again, we have digital transformation leaders from the hospitals in around Mumbai. Let me invite Dr. Vispi Jokhi, CEO Masina Hospital. If come on stage, please. A huge round of applause for him. Dr. Bharat Jagiasi, Director, Cochlear Dhirubhai Ambani Hospital. Dr. Bharat Jagiasi, Director, Cochlear Dhirubhai Ambani Hospital. So Dr. Bharat Jagiasi, Director Critical Care, Kokilaben, Mumbai, right? Navi Mumbai, yes. And Dr. Sandeep Gore, Director Emergency Medicine, Fortis Hospital. If you can join us, please, on stage. COO Fernandez Foundation, Dr. Rahul Datta, CEO Fernandez Foundation. Dr. Ashutosh Srivastava, Medical Director, Aditya Birla Memorial Hospital. Dr. Ashutosh Srivastava, welcome you, Dr. Ashutosh. And Dr. Squadron Leader Nupur Trivedi, Assistant Director, Medical Services and Medical Superintendent, PD Hinduja Hospital. We welcome you, ma'am. So without taking much time, let me start the session straight away. Let me Masina Hospital. Dr. Vispi, we hospital. What, according to you, are the key challenge or barrier in implementing digital technologies in the hospitals, and how can this challenge be addressed, overcome? To your thoughts on that, sir?
We'll be hearing a lot being talked today. And I have always been, while sitting there thinking that there are more challenges than we are all talking of things that will happen, that are happening. But on a day-to-day basis, a hospital like mine, which is a very old hospital, 120 years old with a very old infrastructure, the challenges are humongous. They are not just one or two. They are so many that if I had to talk about them, probably we won't have a lunch today. So there is a big challenge facing all of us, and we are not addressing those challenges. And I think primarily the challenge is, the most important challenge is the data which we are getting. The data itself is not standardized. Everyone has different data sets. We have not even got to the basic level where we can standardize the data and say that, okay, an electronic medical record has to be this way. We don't even implement the ICD code for diagnosis. Even that is not being implemented. So there is a huge challenge. Second challenge is the buy-in from the doctors. The consultant doctors are so varied. There are old timers, there are young people. Young people want to embrace the technology, but at the same time, they want it on their own terms. People don't want to spend time entering digitally anything. People want to, rush from one hospital to another. We don't have full-timer doctors who can, sit and dedicate their work to the hospital. The whole hospital ecosystem is based on consultants who come in. They really don't have that much of stake in the hospital. They think that, okay, I'm going to one hospital, I will do my work and go to the next place. So that is a second challenge. The third challenge is to train our own staff to make sure our staff will buy in. Ultimately, everybody thinks that digitization is dehumanizing healthcare, in the sense there's too much documentation. And many hospitals who go the EMR way, very often the patient thinks that, okay, the nurse is all the time sitting on the computer screen and not looking at me. So that's the challenge. How much of time is spent to, enter the data in the digital format and make it accessible? So there are huge challenges. I think there is, and therefore, I think we must think in terms of taking baby steps, not think of high tech too early. Let's think of baby steps. Let us at least make sure that there is a standardization of data. All the data is uniform. Let there be at least some degree of standardization in terms of the HMIS systems available in the country. There are HMIS systems which are very basic. There are HMIS systems which are AI enabled. There are HMIS systems which whenever we throw a challenge at them as a clinician, they seem to not have an answer. Like, I can give you very simple examples. We have 10 types of diets in the hospital. We tell them that, okay, and what all the variations I want as coming as a drop-down menu. The HMIS is not able to do it properly. So there are a lot of problems. So I think it's not paying so much attention that when you're talking of infrastructure, the things like, doing a fire compliance, doing all these things, the costs are absolutely We just have to comply and face the consequences. Otherwise, if we don't comply, so that's the
think
way I put it.
data is the problem and data is the solution as well. So
The things, yeah.
but as you said, there are a lot of challenges are there. Let me ask Dr. Bharat, how do you think that these challenges can be addressed to transform the hospital ecosystem or the infrastructure? Your thoughts on that?
So as we talking about the data, so we have to have the data-driven policies. So when systems, what we are using, for example, the electronic health record, so we need to have the integrated systems. So it's not only about someone entering the data, but something has to be captured from the system as well. So that way, as Sir pointed out, nurses are spending lots of time in entering the data. If there's a capture from the data or from the system itself, then the time of the nurse is saved that way. And this data is now new oil. This is what is being said, and what we are looking into. If you look into the countries like UK has a national biobank, UK biobank, China, and every country is putting it in a different way. That way, India is very fortunate enough to have a 1.4 billion of a population, and it's a varied population. We have different ethnicity, race, culture. So that way, we can have a different data. But what we have to look into the problems what we are facing is there has to be the integrity of the system. Data needs to be the right, and as we have the branch management system, and every hospital has its own legacy. And I think Mr. Shinde very rightly pointed it out. The kind of data we are having it, those branch systems are not going to be enough. We need to have the cloud base or the different versions of it. Connectivity needs to be different. We are looking to work that way. And of course, the reluctance of the staff. So I, being the end user, being the clinicians, we always are being given the solution in the end. So we've been told to enter this, and if I have to use a harsh word, we've been forced to enter something. So involvement of the end users, that is nurses, clinicians, should be at the early stages. So even the programs, if you see, 80% of the solutions are right, 20% are wrong. But the thing is, someone is not aware about the system. So if some system comes to me all of a sudden and I'm being told 1 month training is there, and after 1 month you adopt the system, obviously I'm not going to take it, because I'm using 10 years of my brain to write the things. And so in 1 month, someone comes and tell me. So if adoption is being planned at the administrative level, it should be put on to the whole system. We are coming up this way, and ideas should be taken so that they feel they own the system, and then they are there to change it. This is what it is. And obviously the robustness of the cybersecurity, you follow the blockchain system or whatever. So that way we have to work with the inclusiveness and integrity. As I told, so we come across the electronic health record. So that's by one company, X company. That company will not capture the monitor, which is of the X plus company. So it has to be the open system. So you go for the open systems, which allow you the scalability and which allows you the
Right, right. A very important part here is that involvement of human resource like doctors and nurses in the early stage of the adoption of technology, and not in the later stage. That's also very important what you have raised. Let me ask Dr. Sandeep Gore. We are talking about digital hospitals or the hospitals of the futures. But as Dr. Vispi has also touched base upon in his initial remark, but do we have that kind of trained manpower with us who are equipped in digital skills, or do you think that we have a long way to go?
Yeah, I think healthcare in India has been changing, and we difference in patient care. Lots of discussion happened since morning about the administrative aspect, but a clinical aspect, I would like to say the data analysis. The data analysis, so we do the digital tracking of the data. For some, I will give example, because once we started using this digitalization and digitalized tools, automatically we'll get trained. Once we start, automatically training will happen. Now, the data analytic played big role in emergency care. We monitor door to needle time for all stroke thrombolysis cases. We monitor door to balloon time for all primary angioplasty cases. And the data analysis has given us lots of insight, like a pre-COVID area and post-COVID. So there is 33% rise in acute myocardial infarction in age group of 40 to 50. So like that, many insights we continuously get. Now we have started another one thing is that 5G ambulance, the smart ambulance, where we can see we use the Internet of Things for these things. We can lively see the patient from the ambulance with the monitor, and we can track that thing. At the same time, by sitting at this forum, we can see the which bed
what patient is doing. So Internet of Things we started using, and it has made a huge difference. Another thing is that artificial intelligence. We use point of care ultrasound in emergency department. Some machines are empowered with artificial intelligence. They will say the important things. What is if we put the probe ejection fraction? What is the pumping capacity of the heart? What is the hydration status of the heart? So all these things has revolutionized the patient care, and it has improved. And since the uh, medical people are involving this thing now, digitalization, now this smartphone has and laptops and tabs had made a big revolution in digitalization. And I think the young generation is more pro for these things. So I have observed that in my team, the younger people who are coming in the department are rapidly adapting themselves for the digital technologies. I think that we are going very rapidly, and digitalization is imperative in the healthcare sector, and it has potential to bring a big change which will affect directly patient outcomes.
Right, right, right. Thank you so much, Dr. Sandeep. Let me ask Mr. Rahul Datta, CEO of Fernandez Foundation. Mr. Rahul, uh, you heard Dr. Sandeep as well. But if I may ask you that, in terms of enhancing digital literacy among professionals, do you think that educational institutions, government, hospital stakeholders, and industry, most important industry also, they should all come together and brainstorm and make that future road path? Do you think that is the need of the hour? Because if forget about healthcare sector, the biggest problem of India today is that employable skilled workforce. That is a huge problem. That encompasses healthcare as well. And when you talk about niche segment like health tech, you need skilled workforce. So do you think the time has come that all and ensure that that is happening on ground?
Good afternoon, everyone. Thank you, Souvik and APAC team, for this opportunity. I think what you are raising as a point, Souvik, is probably we need to look at all coming together, definitely for sure. But at the same time, we need to, I believe that we need to make our houses in order first as well, like Dr. Vis there. What is the level of our awareness within our own staff, within our own doctors? What is the culture that we're looking at in an organization? What is the intent from, like Dr. Clive said, what is the intent from the stakeholders of the organization's buy-in, whether the users or at the management level? Once we have these things in place, we should be able to drive it, because while I understand that we need to treat carefully in terms of taking baby steps, but at the same time, we have to see that last 3-4 years, especially after COVID, digitization is rapidly moving, and technology also, after we see ChatGPT, AI, and so many things coming up, is rapidly moving. And the only, I would say, irony is that in our healthcare industry is that probably we need to move faster, I believe, compared to what we see in insurance and BFSI industries as well. So compared to those aspects in our healthcare sector delivery, we can work on that. And then, as we're talking about ABDM, as we're talking about government also pushing for data repository, we're talking about keeping one health data everywhere. So all these things would push us somewhere that we work together. Within the organization, it's very, very important that we understand of creating digital literacy among all stakeholders. If we look at even, for example, in our hospitals also, we have actually removed all registers from even the most under-educated, if I may say this way, security department, transport department. They use tabs. And it is possible, if the intent is there, if we push toward that way. And these all are requirements. So we talked about maintenance department, because electricity, energy conservation, so those cadre is also included, as well as nurses, doctors. So there is no stakeholder which is actually left out, where the emphasis has to go of coming together in terms of training. And more importantly, government and other private institutions can come up with actually defining courses for non-technological or non-technical person to actually create more awareness and have certified or certification courses.
Right, right. Thank you. Thank you. Very important point you have raised, Mr. Rahul. Let me ask Dr. Ashutosh Srivastava, Medical Director, Aditya Birla Memorial Hospital. Dr. Ashutosh, what according to you is the uh, future of digital hospital in India? The Where do you see India going 5 years down the line?
Actually, everyone has spoken about the digitalization. Nothing left for me.
No, I'm asking that
Ah.
your thoughts, that you must be uh, having something else in mind, that you must be thinking that no, these are the challenges which we should address first, or do you think now India is doing well and they're in the right track? So that's why I'm asking you that.
So now with digitalization, we have to draw the boundary with Maharashtra Medical Council. With digitalization, he can take a second opinion from anywhere from India. So we have to think about these boundaries also. And secondly, for example, any medical practitioner wants to take pictures, then they have to take the consent, like for radiology, for means you take the this organs or cavities or tissues, you have to take consent for everything. But when the patient takes picture, they take pictures of the body parts. So anything which is taken picture, which has been taken picture, it becomes part of medical records. So when a medical professional is doing something, then they have to take the consent. But when someone else is doing something for the medical record, then they don't have to take the consent. There are certain gaps in the system which we have to think.
It's a
And we
very
have to-
important gap itself that needs to be addressed. Uh, uh, we have with us Dr. Squadron Leader Nupur Trivedi, Assistant Director, Medical Services and Medical Superintendent of PD Hinduja Hospitals. Ma'am, if I may ask you that, what is your tech vision for the overall transformation of hospitals vis-a-vis, if you talk about the patient safety, cybersecurity, energy management? So your thoughts on that, what needs to be done more?
All very happy to be here and thank you for the same. Yes, the topic is the digital hospital of the future, but I would like to take a page out of the past where I was part of such a digital hospital. Albeit, there were, of course, challenges, there were gaps, there were various concerns. But in this particular hospital, everything was digitized. So if I would, as a medical administrator, ask for a patient file, I would get file with exactly 2 to 3 pages, because these will be the consents which are medico legal and therefore need to be printed and signed and kept in the file. Rest everything from the registration to the OPD management to the IPDs to the OTs to any other service of the hospital within the hospital, everything was on the system. And therefore, it was not only very surprising, but very pleasurable to see the doctors of that particular chain of hospitals. They had around 12 hospitals, and every doctor, every nurse, every junior doctor, every executive was using the platform. And yes, they would come to us by saying that so and so particular develop standard or objective of the NABH or the JCI. Therefore, it took care of everything from the aspect of patient safety, from the aspect of monitoring the clinical quality in this hospital. The data which we collected and which we could analyze month on month gave us a lot of insights and made the decisions very way ahead of being right and patient centric. So yes, if they could do it, definitely in the future any hospital can do it. It's just a matter of adoption, and the adoption will only come, which I believe will come, if we start training these doctors in the medical colleges. We have to have the medical collegist online. Everything starts from there. And the adoption, why in this particular organization was better, because yes, Many of the doctors had returned back from either UK, US, Australia, had used those systems, and therefore the adoption was much better. For the doctors who were totally educated and trained in India, it was difficult. And therefore, they always asked for some physician assistant or some clerk or somebody to put their entries and orders into the system. But gradually, everyone had to get trained. And so I believe the training, which has to start at the medical college level, and that will only improve the adoption. The other very important aspect is, if cricket can use predictive analysis, why are we not using it? I think we have so much of data already collected, whether in digital form or non-digital form, but we are just not using this data for our decisions. We need to start doing that. And fast track to future hospital would be definitely based on this skeleton of the HIS, the EMRs, which we already have in the market, and people are using it in various hospitals, would be to enhance patient experience through augmented reality, which is creating these smart rooms, the smart beds, which we are talking about, the immersive technology, which enhances patient experience, which so much of relieves so much of anxiety of, say, a chemotherapy patient, a pediatric patient going through a procedure. These immersive technologies will bring in so much of sense of peace and being able to go through a procedure. The smart rooms will to go for their rounds, immediately put their orders and instructions there itself in the room, thereby reducing the time that they will take to go to a nurse station, put it on the system, or the nurse doing it inside the room, and everything just following, because it would flow through the ecosystem.
Right. Very important points raised by you, ma'am. But I'm afraid that we're running short of time, so I won't take any more time for the panel discussion. If you have any questions, we can take off the line during the lunch break also. So thank you so much. Can we have a huge round of applause for all of our esteemed speakers for this panel discussion on digital hospitals of the future. I can thank Dr. Vispi Joki, Dr. Bharat Jagiasi, Dr. Sandeep, and Dr. Squared Lydon Nuput. Then we'll start the felicitation ceremony of our eminent speakers who have been part of APAC HealthTech Innovation Conclave for last 2-3 hours with us. We thank all of you for joining. So I hope all our eminent speakers are already inside the hall, because we're going to start the felicitation ceremony of APAC HealthTech Innovation Conclave. We just wanted to recognize the efforts of the digital transformation leaders from the hospitals of Mumbai and Maharashtra, along with the industry leaders. That's why this felicitation will happen. And for that, I would like to invite Mr. Gopi Krishna, co-founder of APAC News Network, to come on stage. Mr. Gopi, if you can come on stage. Also, Neha. So here we come. First of all, I would like to thank all of you for joining us today with speaker, with delegates, and staying back for last 2.5 hours with us. We have on stage Gopi Krishna, a co-founder of APAC News Network. I request Gopi, if you're ready, you can start the proceedings. So let me first invite Dr. Srivatsan Sridhar, Group Director and COO, Sir HN Reliance Foundation Hospital and Research Center, to come on stage, please. A huge round of applause for him, please.
Humble note here. Our groups for this meeting for
Thank you so much. Thank you so much for joining us today. Parag Rindani, CEO Okhad Hospitals, to come on stage, please. Can you have a huge round of applause for him? Request all the to stay back because we'll have a group photo with these certificates in hand of all the hospitals together. That is Dr. Parag Rindani, CEO Okhad Hospitals. Thank you so much for joining us today. Bubade, CEO KJ Somaya Hospital Research Center. A huge round of applause for her, please. So, Mr. Nilesh Shinde, Group CTO, Jupiter Hospital. So honored to listen all of you, especially. Let me invite Vilu Williams, Group CIO, Grand Medical Foundation, Ruby Hall Clinic, Pune. Come on stage, Let me invite Dr. Kunal Punamia, CEO SL Raheja Hospital of Fortis Associate. Dr. Kunal, you can come up. Dr. Nilesh Singh, COO MRR Children Hospital. Dr. Nilesh Singh. Group CEO, Okhad Hospitals. Hospital, Dr. Hardik. Thank you for joining. Dr. Vispi Jokhi, CEO, Masina Hospital. Dr. Vispi, you can come on stage, please. Just heard him in this panel discussion. Thank you so much for joining us. Let me invite Dr. Bharat Jagiasi, Director of Critical Care, Money Hospital, Naim Mumbai. I think now I'm correct. Yes. Sandeep Kore, Director, Emergency Medicine, Fortis Hospital. Mr. Rahul Datta, COO, Fernandez Foundation. Let me invite Dr. Ashutosh Srivastava, Medical Director, Aditya Birla Memorial Hospital. Today, the Assistant Director, Medical Services, Medical Superintendent, PD into the hospital. That brings we thank Schneider Electric for being the support for this event. And now I also request Mr. Bhupesh Arora, Business Head, Digital Energy Division, Schneider Electric, to come on stage. Gopi, if you can kindly hand over. By Sunil Kumar from Schneider Electric. Let me invite Preta Sharma, Segment Head, Building, Schneider Electric. He's here. Can join us on stage. Can I request all our esteemed speakers who have just received this speaker memento certificate, can all join us on stage for a group photo. I think Mr. Nilesh is also here and Shweta is also here. If you can come on stage, both Mr. Nikhil and Shweta as well. Thank you so much, all of you, for making this event a success. Please follow, keep on following APAC News Network, social media, and can we have all our esteemed speakers on stage, please, for a group photo? You can all join us, please. Please, you can carry the certificate if you want. Yes, you can come on stage. Okay, Gopi, we missed one name, Gopi. We need to also invite Mr. Sankareshwan Jayaraj, Head Infrastructure Project Tata Trust. Here? Jayaraj is here? Yeah, sorry. Yes. Thank you, Mr. Jayaraj, for joining us today. Thank you so much. Speakers of the day, if you can kindly join us on stage for group photo. For lunch. Thank you so much. So, just to inform all of you that during your lunch break, by having a lunch, you can also see a demo section is there by Schneider Electric. That will also give a person an idea what they're doing.